So, the biggest thing that most people should be aware of with this virus or this disease is that these patients decompensate very quickly in terms of requiring supplemental oxygen or airway protection. So it's these are a select population, people who are immunocompromised, and that would kind of be defined as, you're elderly over the age of 65, people who have underlying immunocompromised state like cancer patients. But we're also starting to see how overall health has some impact in that. So we're seeing that people that have insulin resistance or diabetes or body mass index greater than 30, these people are what I would deem as immunocompromised as well. That could be a 20-year-old. So, so your own personal well-being, you may not categorize yourself as immunocompromised, but in fact, you may be. So, at least early on, if you come in with flu-like symptoms, so fever, sore throats, body aches, just feeling generally, fatigued, this is someone who may have, COVID or, the coronavirus.
Right.
These patients, basically, if they are hemodynamically stable, meaning their vital signs all look okay and they're not having any issues from a respiratory standpoint, we basically send these patients home to self-isolate, for a couple of weeks. But the patients, obviously, that we're seeing that we're admitting to the hospital, these patients, they get sick pretty quickly. In terms of treatments, I don't know that there's really anything that there's been, significant evidence to suggest that we have a treatment at this time. So, obviously the hydroxychloroquine's been getting a lot of press. I know that, not me directly, but I know of other institutions that are using that with Zithromax and, seeing some good success. But these are patients before they actually go into respiratory failure. The ones that are in respiratory failure, they're not really seeing, as far as I can understand this, much success with that. So antivirals, remdesivir is one that is starting to see some traction, and that would be for someone that's obviously much sicker. They're doing a lot of immunotherapies, which in turn will help with, vaccines in the future. So, really what I would stress is, trying to do anything you can to boost your own immunity, and the things that you can do, exercise, obviously, you guys probably speak to that quite a bit with Thorne, but, there's not a whole lot that we can do other than respiratory support, once you develop the acute respiratory distress syndrome or require ventilation. So those are the ones that, really aren't doing so well. I think 80% of those people that get vented don't ever come off the vent. So, that's pretty significant. And that's where the fear comes in. But, for the majority of, the world, they may be asymptomatic or have very mild symptoms.